We're here to talk about some tips for diabetics in regards to physical therapy. So, the first tip is that if you've recently had surgery or an injury, your body is going through an inflammatory process, and that can cause your blood sugars to spike, even if you're on top of everything else and eating the way that you should. So, it's really important that you check your sugars more frequently than you may have been doing before. If they continue to be elevated despite everything that you're doing, it's important to let your doctor know in case they want to adjust your medications. We want to really keep those blood sugars in good range during those times because your healing process is really dependent on having those blood sugars under control. If your blood sugars are too high for too long during that time, it can slow down the healing process and even lead to some complications. So, work with your doctor to make sure that you're keeping your blood sugars under really good control. The second tip is that exercise is fantastic for our bodies, and especially for diabetics, it's going to help us process our blood sugars better and more quickly, and so we can keep our blood sugars under better control when we're exercising. But it's important to know that because our muscles are using glucose for energy, that can also cause our blood sugars to drop low. So it's important before you exercise, and that includes if you're coming into physical therapy, that you're checking your blood sugars before you engage in exercise, and that you're also checking them afterwards. It's also really important to know that your blood sugars can be affected for 24 to 48 hours after you've exercised. So if you've engaged in cardiovascular exercise, your blood sugars will likely drop low if they're going to in a more quickly fashion. So maybe during that exercise or within the next few hours. Whereas if you're using weights and you're doing more body weight exercises, the muscular demand is higher and it's going to affect you longer. So it could even be the next day and up to 2 days that your blood sugars could be affected. So make sure that you're checking your blood sugars. And if you're feeling off, if you're feeling any symptoms of going low or going high, really check and take care of yourself. Take glucose if you're feeling low. Sometimes it's helpful to eat a snack, have a little bit of carb and some protein before you exercise if you're noticing that you frequently go low when you exercise. And work with a diabetes educator, with your doctor, if you're having any concerns or any difficulty with that. Your physical therapist can also talk to you about some strategies to help with those scenarios.